You're watching this video to help you log into Learning Space and to make sure that you understand how to score in Learning Space. So I'm going to share my screen and we'll take you from the beginning, but attached to the email are a few things. There should be the note scoring rubric, so you have a sense of how to do that. There should be the case in case you want to read the case in full. I will share my whole screen with you here. Apologize for my very overloaded email inbox. So if you are like me and you are simultaneously in the clinical login system and in the school environment or the base state environment and the school environment, you're going to need to open a private window or an incognito window. These are called different things, but if you right click on your browser, you should have some choice for something like an incognito window. So the Learning Space URL that you use might just be learningspace.umsmed.edu, or it might have a /email front splash, depending on whatever you use to log in when you did your verification of your login. Okay. And then you're going to use your school login credentials. And then you're going to have a lot less activities probably than I do. When you log in, you'll see those three figures in the middle and then a list of activities. You're going to scroll down to Early Clinical Learning, OSCE 5. That's this one here, okay? And we're going to go to Reports. And now in the top navigation bar, the gray bar, it says Responses, Scores, and preset reports. You're going to go to preset reports. And then to the right-hand side of the screen, it says unevaluated open-ended questions. And then there's a hyperlink that says evaluate answers to open-ended questions. You are going to click on evaluate. Now you have two toggles here, questions or learners, and we want to click on learners. So now this is a list of learners that need to be scored. Your inbox should have something like 25 or 28 in it only. I think each of us are scoring somewhere between 20 and 30 students. We have been very careful to make sure your assignments did not include your mentees. And so you should not worry about that. We're going to go through one that I have scored without you, and then we'll go through one that we will score together. So this is the one I've already scored. Let me orient you to this. Here's your list of learners on the left-hand side. The middle bar or domain is the student's responses, and the right-hand side is the scoring key. So the very first item is the differential diagnosis. It's highlighted in blue, and that if it's highlighted in blue, that tells you what's in the scoring key on the right side. So we said to the learner, list your top 3 differential diagnoses at this point. This student said myoglobinuria, bladder malignancy, and nephrolithiasis. Here's all the things that we said could get points based on the history and physical. I'm trying to be generous without being untruthful. So I gave the learner credit for renal failure due to other obstruction, kidney stones, or renal mass, even though it's a little bit of a stretch, but we are trying to be as generous as possible. I'm submitting that. Oh, I'm sorry. I should point out point adjustment. You always have the option to give them more points. I wouldn't take away points, but you have the option to give them more points here. If you think they had something really reasonable after reading the case in your medical opinion that's not listed in the answer key. I don't think that's the case. I was forced to put in a comment, so I said no adjustment. You can use this comment field here if you have some pearl to teach the learner. I have an example of that coming up. Submitting that. Now we're in the next prompt, which is around diagnostic tests. So remember what's labeled in blue here aligns with what your rubric is on the right. So we asked the students for 5 things they wanted to do next, either recommendations, therapeutic trials, diagnostic tests. This learner said they would get a CBC, urinalysis, CT of the abdomen and pelvis with contrast, 2 liters of hydration, and ultrasound. Now we said ultrasound, absolutely. Anything really to evaluate for obstructive uropathy is going to get them higher points. These 3, I believe, are correlated to higher points. And then this student said urinalysis. Well, not quite urine chemistry, not quite urine sediment. They did say IV fluids. They didn't say any of these other things, but I think your analysis is really reasonable. So I'm going to give this learner an extra point for that. And I'm going to say that that point's for your analysis. I do want to point out to them, they said CT abdomen and pelvis with contrast. I just want to make sure they know as a learning point in their urinary block that you wouldn't want to be using contrast in somebody with an acute kidney injury if you could avoid it. So I'm going to put that little pearl in the comments and I'm going to submit that. This third prompt is pretty easy to score because we're giving them credit for any response. So we asked them to describe 2 ways that bias may have impacted this patient. This learner talks about how even that the patient was screened and found negative for polycystic kidney disease, but the provider may be brushing off what is the patient's main concern of what they saw as their father's disease. It's not 2 ways that bias may impact, but again, I'm being as generous as possible. I'm giving them credit for it. So the SOAP note, this is the most intensive piece of the scoring. I'll take a moment to reflect back on our SOAP note rubric. Because our students gave us feedback that they really ran out of time, this was the first time in ECL they've had to do a graded activity where they brought together the history, the physical, and the post-encounter work. They didn't feel like it was timed with enough room for them to comfortably do that post-encounter work. So many of them fall short on the note. I'm going to tell you that from the beginning. We have promised them that we would be more lenient than originally intended with grading, and the next year we will give more time for the note writing. But the adjustments we've made are really in the assessment and plan. Initially, we had wanted them to come up with a ranked differential diagnosis with sort of points allotted based on how close they were to what we felt were the leading diagnoses in this case. Now we're just going to give them credit if they had a summary statement and 2 items on the differential. That's it. If they have any plan, then they should be getting 2 points. Okay, that's different from what the key is going to prompt you to do in Learning Space. So print up this rubric. It is attached to the email. This will be helpful to you as you go through. Other things in the rubric, we wanted them to have subjective, object, and an assessment and plan. It would be nice if those were labeled. We want to make sure they don't have objective information in the HPI. We want to make sure they don't have subjective information in the physical. So make sure everything's in the right section. The subjective portion or the history portion is 2 points for the entire thing, but those 2 points, we want to see an opening statement. We want to see at least 4 out of the 7 cardinal 7, at least 4 pertinent positives or negatives, and then any relevant past surgical, family, or social history should be included as well. For objective data, we want vital signs, at least 4 of them, and 3 organ systems. The note asks, the prompt in Learning Space will say, do they have a general section in their physical? We found that they weren't categorically taught to do that. So they may or may not have a statement about this patient's general appearance. And then, as I mentioned, the assessment and plan, we're being very generous with. So let's go back to Learning Space so you can see what it looks like. Now we're in the note. This student has a nice opening statement. Has 4 or so of the cardinal 7, symptom timeline, progressive in nature, has oliguria, fatigue, malaise, a shoulder injury. It's been taking Advil. Advil is not helpful. Exercise makes it worse. 2 out of 10, quantifying the pain, located in lower abdomen, non-radiating, urine is discolored. So in the note section, I'm sorry, we want it to be highlighted blue so we can see it here. I'm sorry, I was talking about the subjective content, but we actually need to talk about structure and organization first. So this is a nicely structured note. There's a subjective section, objective. There is an assessment. The plan is not labeled, but generally this has the sections present. They're labeled. The HPI is in the subjective. The objective information is in the objective section. So the organization is good. Getting back to the subjective content, we said that there are most of the cardinal 7 there, the pertinent positives and negatives. We have 4. Actually, do we have 4? Yeah, I think we have 4 out of the 7. and we have 4 positives and negatives. So I'm going to say all items addressed here. Getting down to the objective, we've got 4 vital signs. There's a general assessment here, not labeled. HENT, respiratory, cardiovascular, abdomen, and extremities. So they have all items present for this objective portion, which we're happy with. Getting down to the assessment, remember this is where all of our students tell us they ran out of time. A differential diagnosis. This person has a summary statement, 50-year-old male presenting with lower abdominal pain, oliguria, and urinary retention, concerning for BPH versus nephrolithiasis. So they have a good summary statement. And we want to be generous, so we're going to give them the highest scoring possible. They do have at least 2 differentials here. Don't have to be the ranked differentials anymore that we had in our original rubric. And then for the plan, they had lithotripsy here. They did not include anything else for a maneuver, but they had some plan. And remember, we're trying to be more generous. So because they had some plan, I'm giving them points for plan. So we're going to submit that. And now you can see this number 1 learner and left-hand nav bar is all green. That's been completely coded. Let's go do number 2 together. We're up at the top at differential diagnosis again. If you turn it blue by clicking on it, you have the key over here. This student said medication-induced kidney damage, polycystic kidney disease, or UTI. Now, they did not include anything about obstruction, but they did say due to the ibuprofen use. None of these other things are included. I'm not going to adjust points at all. I'll show you what happens if I submit it without a comment. It's just the way the program is set up. So no adjustment. Now I'm going to submit it. Differential diagnosis is done. Diagnostic tests. This is where we ask them for 5 items of the diagnostic test. So we've got ultrasound of the bladder, CT, dipstick test. I think I'm going to give them credit for, as I did with the last student, urinalysis by adding a point for that. I don't know how that's different from urine sample, but again, we're going to give them the point there. I don't want to give them any credit for CT of the bladder or blood gas. So they don't have any of these other things. And we'll say urine sample dipstick. That's what the student said that we're giving them credit for, submitting that. Impact of bias on care. Oops. This student said lack of V. So that's not a sentence. They probably ran out of time, but I am going to not give them credit. No response given there. SOAP note. Here we go. Structure. I see subjective, objective, assessment, and plan. They've got all sections and they're labeled. Let's think about organization. Is it only HPI in the HPI, only objective here, and only assessment and plan here? Yes, so the organization is good. Let's talk about subjective content. Do they have at least 4 out of the 7 cardinal 7? I'm going to read it. Yeah. And I think 4 out of 7 and 4 pertinent positives and negatives. The only issue is they don't have past medical history, surgical history, family history, any of those things. So they're missing the last few bullets. So it's a really nice HPI. Unfortunately, it doesn't have the relevant historical items that we need for this focused encounter. So some items addressed, not all. Let's move on to the objective. Do they have vital signs? Unfortunately, no. General appearance, they have heart, lungs, abdomen. And I always wonder, was it the standardized patient who didn't say that there was suprapubic tenderness, but the case is supposed to have suprapubic discomfort with palpation. So that might come across in some of your notes. So the objectives are decent. No vitals is a note that I'm going to make down in the comments. Okay, let's keep looking at other things, assessment and plan. So we have 2 items on the differential, but no summary statement. Okay, and remember in the updated rubric, we're saying top scoring box, summary statement, and 2 items on the differential. Here we're going to give them middle box because they have 2 items, but no summary statement. I'm going to put that in the comments. Add a summary statement to the assessment. And then for the plan, let's decide if they give us anything here. Dipstick test, ultrasound of the bladder, urine sample, and urine panel. So remember, we're being generous. We're giving them full points for a plan because they have something. We're not doing any adjustment. And we gave them a few comments on things that were missing that we scored off for. And submit. And this learner's done. Oh, there's something it didn't like. Let's go back and look, because see how I didn't get my green check mark? I got to go back and check what is missing. Impact of bias on care. See, it's yellow. That tells us that it's not done yet. No response given. I'm wondering if it's forcing comments because I'm not giving them credit. No listed impact of bias. Okay, that's what it needed. All right, we're submitting that. So you can see in my list, I have 2 of these done and 66 to go. But hopefully that helped a little bit. I'll type up the steps as well, but at least seeing me do it will give you some input. All right, thank you. And I will stop the sharing and end this video.